You are watching the Doctalk show.
Welcome back. Side effects and drugs are the hot topic of today. As you all realize, recently the government concluded their vaccination schedule against measles, and many parents had complaints about side effects of vaccines. So I want to know from our experts in the field whether vaccines too do have side effects. Ms. Victoria, in your field as a pharmacist, as representing the National Drug Authority, what is your opinion on vaccines? Would you consider them as drugs and side effects?
Yes, vaccines, like drugs, can also cause mild side effects. And usually when we vaccinate, we usually tell the mothers to expect those mild side effects like a rash, a fever, and these are usually side effects that shouldn't worry parents so much. They are known and they don't occur in every child, but some, like we're discussing some factors.
Okay.
We talked about the age extremities, but we also have genetic risk factors because, you know, in our bodies process drugs, but in the processes there are some there's where the genes play a role.
The genes,
so,
okay.
Yeah, so an individual who has certain genetic differences, they may also play a big role in, you know, causing someone
in how the
yes,
side effects manifest.
Yes,
Okay.
so it's not everyone, but some people may get side effects. But for vaccines, usually these are
They are mild vaccines.
And yeah, they are manageable.
Yes, I know I brought in vaccines because vaccines can be looked at as drugs because they're introduced into the body to cause an effect, a desired effect of inducing someone's immune system. But they too can have collateral effects coming along with them. But as you've heard from the expert, the effects are usually minor. So which leads us to the other big question. What are the major effects or major side effects of drugs? So before we even go to the major side effects of drugs, we want to listen from the patient's perspective. Mrs. Regina, you interact a lot with these patients. You listen to their stories. What are patients' biggest fear when it comes to drugs and side effects?
They have lost trust in the healthcare system, which is a very unfortunate issue, and mainly because there are a lot of dysfunctions in the system, which exposes the patients to harm, and mainly preventable harm, so to say. So, and when it comes to medicines and side effects, again, there are quite a number of issues that could lead to side effects, which are really very preventable. And these are at different levels. They are at the patient level, but also the health worker level. So you see, it's like a system where each one has to play their part.
So where do you see the problem is? Why are the patients losing their interest in the health system?
Yeah, first of all, because there has been a lot of commercialization of healthcare. That's why we see that increasingly we are having antimicrobial resistance because of the misuse of these drugs. Then, on the other hand, there's also the overprescribing, basically the poor practices of the health workers.
So there are some gaps in our medical system.
Yeah, there's some gaps. And on the other hand, we have a patient who is very illiterate, has low health literacy, low literacy levels, and is not empowered enough even to engage at an equal level with a health care professional. They're looking at them as small gods. They can't ask questions, but also to remind the patients out there that it is your right to ask questions, and ask and ask and ask questions as much as you can. Don't fear to be intimidated, because it's your right to ask, because it's only then when we ask so that we are able to understand. Because like I said, many patients are not, conversant with these issues. They're very technical, but explaining to them what to expect when you give them a medication, taking their history. Some of them might not, give you the history. If they have allergies, they might forget or don't even think about mentioning that they have allergies to medicines. But as a health worker, please ask them and allow them, provide an environment for them to engage with you, because if you put a communication barrier, sometimes when we greet you, you say, "Good morning, doctor," because you're so fearful. He doesn't even answer, for God's sake.
So it's really scary.
Yeah.
We're really scaring
for
the
God's
patients
sake,
in a way.
answering a greeting does not require a lot of time.
Okay. So your point has been well heard. There are gaps in the health system, issues of communication, patient empowerment, over-prescription. So, Mrs. Victoria, representing the National Drug Authority, what can we do to address these patient concerns? Especially, she has raised important issues such as unnecessary prescriptions, over-prescriptions. What can we do as both as the NDA, since you regulate drugs, and as a health practitioner?
Yeah, I think, she's right. Patients have right to information. That's why as regulators, we try as much as possible to have all the people who place products on the market to avail what we call product leaflets.
What are those? What are
patient
product
information leaflets? This is like literature, simple literature in the products, where a patient can look, understand what they're taking, what this drug is treating, what are the side effects in a simplified way. For those products that don't have such leaflets, it's very important that you talk to your health workers. Our message is always, as you go to visit, be ready with all the questions. What the drug you are given is going to treat. We ask for the expected side effects and get to know. And I have to tell you that most of the side effects sometimes present like the disease. You understand? So sometimes even it's hard to tell whether it's the disease or the side effect. So you know your bodies. We know our bodies as patients. So if I go with a fever, then they give me a drug, and I see something outside the fever. Be curious to know probably this is as a result of the drug I'm taking.
Because they give us those small envelopes or polythene.
Sometimes
they just write 1 times 3 with sometimes the handwriting is not even readable.
So they're wondering where they get these leaflets from.
Yeah, so since our healthcare system is, we are at different levels. So if it's a drug that has been prescribed at hospital where they repack, then the pharmacist or somebody at the dispensing window writes, and that's where you need to get more information about that drug.
From the pharmacist or from the doctor?
From the person giving you that drug.
Okay.
Yes. But in case you go to a pharmacy where you have a chance to get the pack, like for example, these syrups, they usually have a leaflet. Try to, familiarize yourself with what is written. But always engage, that's what she talked about, engage the health worker to explain, because sometimes these are complex things to understand. So my issue is, like she said, let's create that rapport, that time to discuss our issues, because that's why you will also explain the allergies you have to this health worker, open up the herbal drugs you are taking, and the doctor can decide which drug can go along with whatever you are taking.
Okay, so I'm curious to know, you mentioned herbal drugs. Do the herbal drugs have those leaflets?
Yes, now that's the problem. Most of the time, herbal drugs have little information on them. Sometimes they're just concoction from our gardens. They don't have leaflets.
Okay, but you're advocating for everyone to get that information, which is written.
Drug.
Okay, whether it's herbal or normal medicine, they must be able to read that information that is written on the package, or it's inside the box. Or if the drugs don't have that information, they ask the health worker.
Yes, but I think the key point regarding the herbal products is disclose to your health worker to know that, doctor, I am also taking this, because the doctor in their training, their capacity, probably they can try to see whether now what he's prescribing won't interact with now the herbal.
Okay, so bring another important issue of drug interactions, which shall come shortly too after the break. This is a very sensitive issue. When it comes to drug side effects on people's lives, everyone wants to pay very close attention to see what you're going to tell them. So more about side effects of drugs coming up after the break. Don't go away, we'll be right back.
You are watching the Doctalk Show.